Welcome to Spinal Rehab Associates. This is my brother, Dr. Mark Mantuffel. This is Dr. Mark Roble, and I'm Dr. Ron Mantuffel. And today, we're going to do a little follow-up to the video that my brother Mark did, just last week. Now, what we're going to concentrate on today is how we work with spinal disc ruptures and spinal stenosis. And the objective here is to create some compartment space room in the low back to free up the nerves that are running from the low back down into the legs. And we're going to demonstrate that on patients. So we have patients here today. We'll introduce you to the patients as we work our way through the video. All the equipment that we have in this office is identical to the equipment that we have at the 24-mile office. So Dr. Mark and Mark work primarily at the 24-mile office, and I work primarily here at the Columbus office. So we're going to begin today by going a step-by-step instruction and demonstration about exactly how we go about fixing our patients that have disc ruptures and spinal stenosis. So we're going to start over here, and this is Linda. And what we're going to do with Linda has a problem with spinal stenosis. That means that the compartment spaces in her lower back, due to advanced degenerative changes, have gotten smaller. And if I'm going to show you on the spine here, this is a model of the spine. These are the vertebrae here. And once again, to get a better understanding of all the anatomy, please refer back to the video that Dr. Mark did about a week ago. Now, you'll see the lumbar vertebrae, and most importantly, these are the nerve roots that come out of the spine. These run down into the leg. When the compartment spaces on the interior of the spine get smaller, or if the disc bulges and ruptures, it'll contact the nerve root. So what we want to do is create a decompression situation here, and that will allow more compartment space room, free up the pressure. The objective is to prevent this. These are what we call rods and screws, and this is a very popular recommendation nowadays by orthopedic doctors for people with spinal stenosis and disc ruptures. It's pretty invasive. You have to use a saw, cut off the lamina pedicle junctions here, remove the spinous processes. These are put in place and screwed into the spine. So if we can avoid doing that, that's a pretty good idea. So this is what spinal decompression basically looks like. This is the spine. This is the curvature. That's called the lordotic curve in the lumbar spine. Our objective is to open up the compartment spaces. And this is what we're going to demonstrate today. Okay? We're going to take the spine in its normal position here, and we are going to stretch it, stretch all the muscles, ligaments associated with all the vertebrae, and decompress these segments, get the pressure off the nerve roots. Now, the very first thing we're going to do with Linda is we're going to loosen up her spine a little bit. This instrument's called Pro Adjuster. The Pro Adjuster, kind of like a sophisticated spinal jackhammer. What we do is we place this instrument on the vertebrae, depress it, and what it does is it vibrates or oscillates the vertebrae. It kind of breaks up the fixations. Sometimes you get a little rust into the lower spine, especially with seniors. So what we want to do is we want to get in here, break up that fixation, create some movement. Did that hurt at all? No. Okay. Now, what we're going to do is we're going to go over here to, this is called the Cox table. The Cox table was designed specifically to help people with spinal stenosis and disc ruptures. And we're going to show you exactly how this is going to create that compartment space when we talk about it. So the patient's laid on his stomach, and we'll bring this handle up here. raise the table up a bit. And we're going to set the tension. Very first thing we do is we create a little bit of movement, stretching the muscles and the ligaments. In stenosis, one of the analogies that I use is that the spine, particularly in the lower back, is like an accordion. And sometimes that accordion gets shut. And if it doesn't open and close the way it's supposed to, there's going to be a lot of pressure that builds up, a lot of nerve root compression, leg weakness, numbness, tingling, pain. So after we loosen the spine up, we're going to strap the ankles in. Now, the purpose of this is to create a little bit of tension in the lower back. Because we want to get a nice little pull here in the low back. So I'm going to contact with my left hand the vertebrae, and we're going to pull the table down. And this is going to create space between the vertebrae and my hand. And I'm going to move my hand up one segment, take the table down. This is going to decompress the spine. Actually creates a vacuum inside the disc, helps disc ruptures and bulges to come back to their normal position. For a patient that has spinal stenosis, and their vertebrae are all locked up in their lower back, when they lay on this table, and this type of treatment is administered, quite often they'll say, that is exactly what I need. Because it feels real good to get the pressure off those nerve roots. And this is all it takes right here. It's very gentle. There's no thrusting, there's no twisting, there's no cracking. It's a simple stretch and a decompression. Stenosis patients and disc patients generally feel a significant improvement after approximately 1 to 2 months of care at the rate of about 3 times per week. Now when we are done using the Cox table, what we do is we'll take our patients to the next treatment room, or in this case, treatment table at this office. And that is called the decompression table. And my brother, Dr. Mark, is going to show you exactly how the decompression table works. It's kind of like passing the baton from the Cox table to the traction table. This is more of a manual decompression, and now we're going to get into a motorized decompression.
One of the biggest problems we have in healthcare today is surgery for back problems. Too many surgeries are being performed on people that don't need it. Back surgeries are expensive, they're complicated, and if you can avoid back surgery, that's at all costs you should try and avoid it. We have a table here, it's called the Triton Decompression Table, and we have had excellent results on our patients have spinal stenosis and lumbar disc herniations. It's a non-surgical, non-drug technique. Now, if you come over here, I have Sue being treated for her lumbar spine and on this table, and we have her legs are elevated because that flattens the lower back. And as Dr. Ron said, a flatter lower back creates a better environment so we can distract that vertebrae and create a suction effect in that vertebrae. And in case you have a problem like you see on the wall with the herniated disc over there, that's what we're trying to create. We're trying to retract that disc through suction and creating a negative pressure in the disc. So we have a situation right here where we have a computer and it's connected to a harness around the pelvis. We have another harness here that keeps the upper back stable. So we're able to create traction or distraction to the lower back. And you can see right now the table is separated because the lower piece of the machine is being pulled toward her legs, okay? So what we do is we traction, but we don't do it continuously. That's the biggest difference between traction and distraction. So what this table does is distraction. It pulls and holds for 15 to 20 seconds, and then it relaxes for 15 or 20 seconds. Whereas if you go to a hospital, they do traction, pulls for a half hour, and that's not the way to do it. When you push and pull the spine apart, that creates like a pumping action. That pumping action gets more blood flow to your disc, and it greatly enhances the healing process. So Sue, how many treatments have you had on this table so far?
I think this is my fourth.
Your fourth treatment. How do you feel with the treatment? Does it cause any pain at all?
No pain at all.
Is it comfortable?
Yes.
Matter of fact, I heard you say today you enjoy going on this table.
Yes, I was waiting for it today.
That's good. That's good. Now, the idea behind these cases of herniated disc and stenosis, a lot of these patients are having pain down their legs. That's because the nerves in the lower back are being compressed and they're crowded. So if we can create a situation where we free up or liberate those nerves, guess what happens to the legs? They start feeling better. The numbness, the tingling, the burning, the weakness, that's going to improve. And if we could do that without an operation or the cage like Dr. Bond showed you on the earlier video, that we're doing a great job. And a lot of these people will respond beautifully to this traction. Also, I might add that if you have a cervical disc herniation, we're able to do this hook up when you're turning the other way. We're able to stretch the neck and distract the neck. And these are for people that have pain down the arms, numbness, tingling, burning, and weakness. And so we do this treatment on the cervical spine, and we do it the same way as the lumbar spine. We're able to decompress the nerves. We're able to get increased blood flow, and that helps the patient tremendously. And the treatment lasts for about 15 to 20 minutes. Some people need to be on for a half hour. That depends on every case. Now, when the patient is done with this treatment, then we will do what we call physical modalities. And physical modalities are like the icing on the cake. They help the patient get rid of pain, and they make them feel more comfortable. And I'm going to have Dr. Roble explain a little bit about physical modalities, which would be stim, ultrasound, HIVA-mat therapy, low-level light therapy, exercise therapy. These are all things that we specialize in. So, Dr. Roble?
Okay, here we have Rich, and what he's doing is electrical muscle stimulation. And what this does helps a variety of back conditions, helps to loosen up the muscles, increases proprioception. The actual stimulation of the muscle will help to pump out swelling, and it also promotes healing by increasing the blood flow to the area. Now we could do this with heat, ice, we do it in the lower back, we could do it in the neck, or in the middle back as well. It's very painless. It's a modality that's been around for years, and it works very well, especially for pain. And what we do is we kind of incorporate this with our treatment plan, almost on a daily basis for some of our patients. And then the next phase of care would be strengthening. Here we have Diane, and she's on the MedX lumbar core strengthening machine. Basically what this does is helps to strengthen the erector spinae muscles and strengthens the core lumbar muscles. And basically it's kind of like the last phase of care when the patient starts getting better, or we can do it in the beginning if the patient can tolerate it. Diane's going to go ahead and demonstrate a few repetitions here. As you go back, what this does, it'll strengthen up the lower back. It'll help to stabilize the spine, and really helps to really incorporate a lot more strength into the lower back. Patients, if they stick to this program for a month, I've seen patients increase by 60 pounds, 70 pounds just in their strength. And usually we recommend doing it 2 to 3 days a week for 3 to 4 weeks at a time. And Diane, she's a veteran at this, so she's doing very well. And I think that's it for today.